This is Stanford Erickson. I'm editorial director of Chiropractic Economics, and I'm with Dr. Jasper Sidhu, and he is with Wave Manufacturing. He's Vice President, North America Clinical Information and Sales. Dr. Sidhu, you're going to explain what Wave does here. Is that so?
What I want you to do, Stanford, is just put 1 foot right onto the machine. What we do is with patients, we start them off like this first to give them an idea of what this is going to feel like. What I'm going to do is I'm going to start it up, and you're going to feel a little bit almost like a little massage feeling. And what it is you want to put your heel down, and as you put your heel down, you're going to notice the contractions going right into the thigh. What the Wave does, it works on an involuntary stretch reflex. So as the person puts their foot down on the machine, the platform drops up and down and gives you quick contractions. So you can get about 3,000 muscle contractions per second, per minute. And what it does is it takes a rehabilitation time and accordions it. So something like a patellofemoral syndrome that might take me 20, 30 minutes to rehab can actually be done in about 3 to 4 minutes with vibration exercise. Now I want you to go up on your toes, and you're going to notice the contractions going right into the calf area. How does that feel?
That feels very good, and seems to touch my thigh as well, so it's very nice.
Excellent. So what we want to do is because vibration exercise is low stress, low impact, it's going to be very beneficial for a lot of the elderly patients and a lot of patients who can't engage in conventional exercise. That's where vibration exercise comes in. It can be used for a lot of wide variety of conditions like multiple sclerosis, fibromyalgia, chronic arthritis. So a lot of the patients that you're seeing in your office that might not be amenable to conventional training, they can do it with vibration exercise in a fraction of the time.
Thank you. Are you going to then demonstrate this yourself?
Actually, what I'm going to do is I'm going to have Dr. Thomas Hyde from Graston Technique to give you an idea of what we can do with integrating Graston Technique along with vibration exercise. Dr. Hyde, come on over.
Yes, what I'd like to do is demonstrate Graston Technique, which is an instrument and assisted soft tissue mobilization technique that looks at all different types of musculoskeletal disorders, particularly in the fascial system. And we're going to show you that it can be used both in the acute and chronic phase, in addition to being used alone with the Wave product. It's a great combination of the two of them.
Now, what are you doing now?
What I'm doing now is actually we're going to work him in both the eccentric and concentric phase over the Achilles tendon and the lower gastrocsoleus complex. And we found that if we use the combination of the vibration plate with the Graston technique, the recovery time is absolutely sped up. In other words, we're incorporating rehabilitation at the same time while we're providing a soft tissue mechanism for treatment of the underlying disorder.
Dr. Sidhu, how does that feel?
That feels amazing. I've been using Graston Technique for a while also, and this is about combining rehabilitation and assessment and training all in one. So what it does, it allows you to take that rehabilitation time and really decrease the amount of time it actually takes you to treat that patient.
Is it painful?
No, it's not painful at all.
That's I always wonder about pain, but
it's very simple, very easy, and very effective, and very quick. That's all the time we need to treat him.
Are you going to do any other kind of technique?
Not at this time.
Okay.
Thank you very much.
Thank you, Dr. Hyde.
You're very welcome. My pleasure.
Thank you. Anything else you'd like to say on this?
We've been having a lot of different chiropractors use it, again, for rehabilitation purposes, but what we're also finding it as a wellness tool. A lot of chiropractors are starting integrating this by buying 1 or 2 machines and opening up a little vibration exercise studio for their patients. And what that does is it allows patients, after they finish their rehab and their chiropractic care, they can get post-discharge to a wellness. You can use it as an unsupervised exercise, as a membership program, as a personal training program. So it's really a combination of bringing almost like a fitness center within a chiropractic office.
Dr. Sidhu, if this chiropractor wants to follow up and get some more information on this, how can they contact you?
They can actually visit our website at waveexercise.com. That's 1-E-W-A-V-E-X-E-R-C-I-S-E. Or they can call our toll-free number at 1-866-420-7546.
Thank you very much, sir.